So now we're going to move to cholinergic medications. And cholinergics work on the parasympathetic nervous system. So the way I think of parasympathetic nervous system is it starts with P, so it's PI, which is rest and digest. So this is actually going to be relaxing your body. So it's the complete opposite of adrenergic drugs. Cholinergic drugs can be known as cholinergic agonists, so they're going to turn on those receptors. And they can also be known as parasympathomimetics. So mimetics, I think of the word mimic, so it's going to mimic the parasympathetic. When it comes to cholinergic medications, there's two types. There's direct acting and indirect acting. For the direct acting, they're going to directly bind onto those receptors and turn it on. The indirect ones are going to inhibit enzymes that break down acetylcholine. That's their mechanism of action, meaning that there's going to be more acetylcholine moving around through the body. Acetylcholine medications, you want to just remember that they're going to deal with all your secretions. So they're going to increase secretions. So tears, mouth, digestion, urination, sweating. And this is going to be important for a bunch of different other diseases. But opposite of adrenergic, instead of dilating your pupils, they're going to constrict them. It's going to decrease also your heart rate, and it causes bronchoconstriction. So if you remember with adrenergic kung fu fighting, this is the opposite of all of that. Here I'm going to post some of the common direct acting cholinergic medications. So just pause. Why would you want to give this kind of medication? So imagine a person who can't salivate, which is going to be Sjögren's, I think that's how you pronounce it, syndrome. You would give them a cholinergic drug. One of the medications is this, I can't pronounce it. And that's going to increase their salivation. Why would you give a patient indirect acting cholinergic medications, right? You want there to be more acetylcholine going throughout the body. And this is going to be important for patients that have like myasthenia gravis, where their muscles aren't really working very well because there's a reduced amount of acetylcholine. So if you give them the medications, which usually end in stigmine, they're going to be able to move or digest. Their GI motility is going to increase. They're going to be able to salivate, which is really helpful for them. It's also used in the treatment of Alzheimer's, so make sure you know which medications treat what. One of the contraindications for cholinergic medications is going to be if a person has a GI obstruction. Since you're improving the motility in their GI, if they have an obstruction, you're going to actually cause them to perforate or rupture and then bleed inside, which is not something we want for them to do. So make sure that you look at your patient's history and that they don't have a GI obstruction. How do you manage if a person has toxicity, or how do you know if they have toxicity? You're going to want to use the acronym SLUDGE, and that's going to be if they have excessive salivation, lacrimation, urination, diarrhea, GI cramps, and emesis. If they have this, they have a toxicity, the cholinergic medication. If a person is in early stages of a cholinergic crisis, you can give them atropine as the antidote. And something that I was tested on about cholinergic medications was if a person has Alzheimer's, is to let the family know that these medications aren't going to cure Alzheimer's, and that it can take 6 weeks before you can see the effects of the medication. And all it's doing is just improving their life, not fixing Alzheimer's. A medication that sometimes is given to determine whether a person has myasthenia gravis or they're having a cholinergic effect is idrophonium. And I was struggling how to remember this, and my little tip was when you are on Who Wants to Be a Millionaire, you phone a friend to get the right answer between two answers. Make sure that if your patient has myasthenia gravis, if you're going to give them their medication, you want to give it to them 30 minutes before they're eating. That way that acetylcholine is there and everything works inside their body. Don't forget that.